This is 5 things you missed in the world of science this past week. I'm Max. I'm a medical student. I give you the coolest and hardest to find science info before anybody else. Number 1, stroke is the second leading cause of death worldwide, and scientists wanted to figure out whether giving this medication could reduce the risk for a future stroke. So they took 12,000 patients that had a recent stroke, and they gave them this medication, and the results are nuts. Adding asundexian onto a platelet therapy dropped future stroke risk by 26%. This is the biggest news we've seen in blood thinner medication in years. And unlike current blood thinners that increase bleeding risk, this one doesn't. Number 2, what if we could prevent cancer before it even happens? That's what this study found. So multiple myeloma is a deadly blood cancer, and before an active cancer diagnosis, we can see cells in the blood and like weird proteins that kind of alert us that, hey, this patient's high risk. It actually has a name. It's called smoldering myeloma, and 50% of patients go on to develop multiple myeloma in 2 years. Using CAR T-cell therapy on the pre-cancer stage, they saw that none of them developed a single detectable cancer cell at the 15-month follow-up. Follow-up past 15 months is still ongoing, and I know I mentioned that 2-year mark. The thing is that they detected zero detectable cancer cells. That is amazingly huge, and I can't even begin to explain how amazing that is. So I hope you guys can understand that. And the best part is that this is making cancer prevention more of a reality. Number 3, this one's cool. So the FDA just approved the first gene therapy for deafness. It was specifically approved for deafness associated with the OTOF gene, and the coolest part of this is that it's a single infusion. And to me, there's a couple things that make this super important, and one of them is just like we're making progress in curing genetic diseases. This is like one of the many that we're going to be able to cure in the future. And the second thing is that this is the first gene therapy approved in the FDA's new ultra-fast approval program. It usually takes at least 6 months, if not like 10 months to get a therapy FDA approved. This one happened in 61 days. Number 4, 1 in 3 Americans have fatty liver disease. And until now, there wasn't a medication for the early form of it that most people have. In an effort to fix that, they gave mice a cancer medication that's currently in clinical trials. It's a senolytic, and it also is being studied potentially as a longevity medication. The medication is called navitoclax, and they saw that it completely reversed the disease, and the mice were still eating like typical Western diets, like stuff like what Americans eat. This will most likely enter human clinical trials very soon. Number 5, if you've been following along, you know I report on incredible studies we've been seeing using this. And President Trump just signed an executive order reducing FDA approval times from like 6 to 10 months down to 1 to 2 months. This is the biggest US regulatory policy shift I've seen in this area like in decades. I don't know, like this is literally insane. And don't get me wrong, based off the sheer amount of data we've been seeing with this, with like studies and clinical trials, especially with postpartum depression, I am not surprised.